Military Medicine and WarDocs present a Ready Medical Force Special Collection. We speak with the authors of recently accepted journal articles addressing the key readiness issues in operational medicine and discuss the importance of their findings. Welcome to WarDocs, the Military Medicine Podcast. This show brings you a first-hand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, WarDocs has you covered.
Welcome to WarDocs. I'm your host, Major General Retired Jeff Clark. Our guest is Dr. Ted Melcer. Dr. Melcer is a civilian research psychologist and primary investigator at the Naval Health Research Center in San Diego, California. Dr. Melcer has served with the center there for about 25 years, joining that team about a year prior to 9/11/2001. Dr. Melcer's research informs medical decisions and processes to improve rehab outcomes for service members wounded in Iraq and Afghanistan. And I think it's worth noting that the Naval Health Research Center's motto is readiness to research and development. How appropriate that is. Dr. Melcer, welcome to WarDocs.
Thank you. On behalf of our team, we're happy, honored to receive this recognition and the award. Thank you.
Yeah, Ted, thanks. And as Dr. Melcer just mentioned, he is the lead author on Military Medicine Journal's 2024 Article of the Year. The article is entitled, Prehospital Ketamine Associated with a Change in the Prognosis of PTSD? Dr. Melcer and his co-authors received this prestigious award during the March 2025 annual meeting of the Association of Military Surgeons of the United States. Most of us refer to it, just say AMSIS. I was able to attend that meeting. Outstanding gathering as always, over 2,000 attendees. So Ted, congratulations to you and your team, and thank you for being a guest on WarDocs. Let's begin by having you tell us just a little bit about your background and how you came to serve with Naval Health Research Center.
Sure. I'm a research psychologist, as you mentioned, a PhD in research psychology from Indiana University. Worked in basic research and later did postdoctoral work in research epidemiology at University of California, San Diego. Just before starting work at NHRC. I started work just maybe a year before 9/11. And just after that, we're a research institution. There were calls for the need for data from the battlefield to inform medical care, to understand as carefully as possible the injuries being sustained by service members, the early post-injury treatments, pre-hospital treatments, and how they might affect outcomes. So a lack of data, sparse data, motivated our department head, Mike Arlarno, our senior author, developed an expeditionary medical encounter database, which was based on collecting casualty records, based on provider treatment notes, recorded treatments, surgeries, and so on, medications, and using clinicians on our team to analyze those data and convert them to research quality data for analysis to give feedback again on what's happening on the battlefield and what impacts those treatments had on patient outcomes.
So tell us a little bit about why you and your colleagues did this particular research.
Yeah, so some of the earliest pre-hospital requirements are to control pain, particularly for patients who sustain severe injuries. And historically, morphine, opioids such as morphine were the standard on the battlefield for pain management. They do have risks, and that some recent research, probably around 2010 or that time frame, there was interest in ketamine, low-dose ketamine. It turns out to be a very good analgesic and has fewer side effects than opioids. It's a little safer, particularly for patients who sustained serious injuries and lost a lot of blood. So ketamine, low-dose ketamine was introduced into the clinical guidelines, the tactical combat casualty care guidelines. There wasn't much research in terms of the potential impact on long-term outcomes, such as psychological effects. It was known. There were some reports, sparse reports, that it might help reduce anxiety, improve psychological well-being in short and long term, but there were other reports that it might increase anxiety. So there was a need for some systematic study based on battlefield records. What are the psychological effects of ketamine compared with opioids?
It's a great question, and thank you for answering. If you could just kind of briefly just summarize before we get into the details of your research and you walk us through it a little bit. Can you kind of give us sort of the bottom line summary of what you found?
Sure. Yeah, our data based on the casualty records, we found our results show an association between pre-hospital ketamine compared with opioids and lower odds of later PTSD. So the data suggests ketamine compared with opioids may have a protective effect on development of PTSD. So that's good for the patient's mental health. It is an observational study, so that's sort of the bottom line, the association between ketamine and lower PTSD outcomes.
That's right in line with the research you do in general. One interventions that we do early may have implications for overall well-being further down the road. And so that's critical. So if you just take a couple of minutes and kind of summarize your research for us, kind of what was your methodology, what were your results, limitations, and your conclusions, and maybe even implications for further research.
Sure. Methodology, as I mentioned, there was sparse research in terms of background, so there was a need to understand if ketamine had benefits in addition to managing pain, if psychological benefits or even psychological risks for the patients who already sustained substantial trauma. In terms of methods, clinicians reviewed the casualty records and they coded information on detailed information on patient's injury severity, medications received in pre-hospital settings near the point of injury or during evacuation, and other demographics, age of the patients, whether the patient was injured by a gunshot or a blast weapon, all these variables, multiple variables, a lot going on the battlefield to consider in addition to what medication the patient received. So it was observational, and the goal was to try to relate these variables, particularly pre-hospital medication, ketamine versus opioids, on the outcome. The primary outcome was whether or not the patient had a diagnosis of PTSD in his or her medical record during the first year post-injury.
It's outstanding. I appreciate your team taking the time and effort to do that and to get it published so that we can all learn from it. So thank you for that. Yeah, and as we start to wrap things up a little bit, if you could, again, share with our audience implications of the research. I know it has implications for TCCC, as you mentioned. So if you would summarize that for us, that would be appreciated. Thank you.
Sure. The clinical implications, most important, this is relevant for the tactical combat casualty care guidelines. They inform medics, first responders, corpsmen in the field. They're in a difficult situation. They have to make split-second decisions. And so they are tasked with doing a number of things, life-saving treatments, but also managing the patient's pain. So the consideration for the guidelines is to consider that ketamine not only is effective to manage pain, fewer side effects versus opioids, but it also may be protective in the long run, may have psychological benefits and reduce the patient's chances of PTSD. Other implications of the research are that these data are very valuable. Casualty care data are hard to come by. We need to squeeze every bit of information we can out of them and try to inform providers and, as I say, medics for the welfare of patients. So connecting those battlefield data with long-term outcomes is also valuable. The providers, physicians, the Navy Medicine Command are always calling for these types of data. So I think the implications, in addition to the informing on the psychological benefits of ketamine, is the value of the EMED or EMED database, trauma registries generally, in informing medical care, not only in the United States, but on the battlefield in very difficult situations.
A recent episode of WarDocs by Dr. John Quinn, who is an EMT and an emergency medicine physician, non-governmental organization, spent a lot of time in Ukraine, and he makes some of the same points, particularly about having data, like the data you use in Joint Trauma System, and pulling everything we can out of that data for research and development, which is really the essence of what the Naval Health Research Center does. And so we appreciate you doing that. And again, for the research that it has, it lets us know the things that we do in the acute setting, ketamine for pain control, and maybe an association with decreased risk of PTSD. The things that we do in the acute setting have implications for the long-term well-being. So it's absolutely critical research. And Ted, thank you. Our guest has been Dr. Ted Melcer. Ted, congratulations to you and your team for being awarded the AMSUS Military Medicine Journal's 2024 Article of the Year, a prestigious award. We thank you for being a guest on WarDocs, and perhaps most importantly, we thank you for the important research you and Naval Health Research Center do to inform military medicine.
Thank you. We're honored again. Thank you.
So I encourage all of us, anyone who has not yet read this incredible article entitled, "Is Prehospital Ketamine Associated with a Change in the Prognosis of PTSD?" Is published in the July-August 2023 edition of Military Medicine. I encourage you, if you have not read it, to do so. As you know, if you're already an AMSUS member, you have easy access to this outstanding article, as well as all the very informative articles that Military Medicine publishes. If you're not yet a member of AMSUS, I encourage you to do so, to join this outstanding organization of federal health professionals by going to their website, www.amsus.sus. Thank you for joining us. May God bless.
Thank you for listening to WarDocs. We sure hope you enjoyed it. WarDocs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team WarDocs on WarDocsPodcast.com. Thank you for your support. If you like war stories and medical drama, WarDocs has you covered. Spread the word.